Maddie was diagnosed with acute lymphoblastic leukemia when she was 18 months old in November of 2021. She had 26 months of chemo, and then I was diagnosed with breast cancer. I had surgery, radiation, and chemotherapy. When I was finished with that, I was diagnosed with a small melanoma, which I just needed surgery for, thankfully, but it's still scary. I mean, there's no two ways about that. I often went back and forth on whether working at Smilo as an oncology nurse made it easier or harder for me. It was still scary, it was still terrifying, but I couldn't imagine taking her anywhere else. I've worked at Smilo for 10 years now, and I've seen the positive changes that they can impart on patients and families. They include the whole family in the treatment. There's so many different supportive care programs that Smilo offers, and I think that we're not just treating the patient, we're treating the patient and their family. There are so many other programs like that that continue to support patients even, after their treatment's done, and a lot of those programs wouldn't be possible if it wasn't for the Closer to Free ride. I remember working a weekend when I worked on labor and delivery, and I could see the ride out my window, and I remember thinking, I'm gonna do that one day. And then once Maddie was diagnosed, I had no question. She pushed through so much incredibly difficult treatment. If she can do that, I can do this. It's a really nice way for us to be able to give back. The effort that we're putting in is going directly back to a cause that's so important to us. This is a really nice way that you can directly see the impact. If someone was questioning whether they should do the ride for the first time, I would say without a doubt that you should. It doesn't matter how many miles you ride, it's just so much fun and it's so meaningful, and it really does make you feel good at the end of the day.